Yes, sir. Yes, sir.
Okay. Madam, Madam, start.
A very good morning, one and all present over here. It's my pleasure to welcome you all for the second day of first year and direct second year's induction program 2020-21. Today, we are back with the cluster of expert lectures to enrich you and to support you to pursue your career path. Let us start the day with our first session. I feel honored and privileged to introduce you the guest for the session, Professor KG Madhusudan. Sir has more than 8 years experience. He worked as a tutor in Bangalore and since last 6 years he has been working as a lecturer in the Department of Community Health Nursing at MIT Nursing College, Aurangabad. Now, I request Professor Madhusudan sir to brief our students on the topic importance of cleanliness, health, hygiene, safety and gender equality. Sir, please.
Thank you, ma'am. Uh, shall I begin my class?
Yes, sir, please continue.
Yeah, ma'am. Thank you. Good morning, all of you. Can you hear my voice?
Yes, surely, sir.
Hello, students. Good morning.
Sir, students can't
First, I would
reply
like to
you.
thank. Yes, sir. Can you hear me, ma'am?
Please continue, sir.
Okay, ma'am. Okay. First, I would like to thank Principal Deshmukh sir for giving me the opportunity to take in class for the induction of first year Polytechnic students. And next, I would like to thank Maske sir for giving this chance. Today, my topic is about the cleanliness, health, hygiene, and safety, and about the gender ratio. Students, why the cleanliness is important for us, being a human. The cleanliness, it is our rights to be keep clean ourselves and to keep clean our society. It's because of the environmental pollutions when the peoples we are not going to keep the sanitation clearly, it affects the health first. So that's why the cleanliness is very important. For keeping this clean, the governments and certain other authorities are creating awareness to the publics, especially from the educational institutions, to create an awareness among the publics in the community area. So because of that, the government of India, what are the steps to be taken? And before that, I would like to give a clearance to you people all what is meant by cleanliness and how does it important for the human life. If we are not keeping our surroundings to be clean, what are the effects or the hazards are we are going to be face? So now I will move to the steps or initiation taken by the governments to keep clean our society. Have you all heard about the Swachh Bharat? Swachh Bharat, it is the steps taken by the government of India since 6 years. They are launching several programs under the Swachh Bharat missions. Just having two slides here. Sir, can I get the slide, please? Sir, next slide, please. Next slide, sir. Sir, can I get the next slide? Slide, please. Hello, sir. It's not connecting. Slide. If you're coming to the health aspect, the cleanliness is the first law to keep ourselves healthy. So based on that, the steps taken by the government, it is the Swachh Bharat mission. Under that, it has the responsibilities of all the citizens who are living in the country to keep our society to be clean. So slide. Sir, can I get the next slide? सर स्लाइड्स आप ऑपरेट कर रहे थे सर यहाँ पे नहीं हो रहा है सर इसलिए आपसे पूछ रहा था मैं नीचे हाँ सर ओके कब सर ये उसमें बॉटम में नहीं सर ये स्क्रीन यहाँ पर ये हो रहा हाँ सर विंडो सर मल्टीपल ही हो रहा है सर यहाँ पे मल्टीपल ओपन हो रहा है सर यहाँ मल्टीपल ही ओपन हो रहा है सर वो सर यहाँ पे नहीं आ रहा था ಥರ್ಡ್ ಸ್ಲೈಡ್ ಇದೆ ಆಗೋದಿಲ್ಲ ಇದು ಶ್ರೀ ಮಾತಾಡ್ಬೇಡ
Students, please wait for some time. We will share the PPT and the lecture will continue. Please wait for some time. The lecture will be continued after some time. Please stay tuned.
Can I start, sir? Okay, sorry for the inconvenience. I will start the session. I was talking about the steps taken by the government about the cleanliness. It's about the cleanliness is the first law of our health, and the steps taken by the government is the Swachh Bharat mission. Under this, government has been launched several programs to reach to the publics and creating an awareness about the cleanliness to the publics, because India has been noticed from the WHO and other associations in the world. We are having a lack of sanitations. मतलब है हमको क्लीनिंग का ज्यादा प्रॉब्लम है, इसके वजह से ज्यादा कम्युनिकेबल डिसीजेस स्प्रेड हो रहा है इंडिया पे बोल के देयर वाज ए बैड टॉक अमंग द वर्ल्ड. सो बिकॉज ऑफ दैट द गवर्नमेंट हैज बीन टेकन द इनिशिएशन, वी नीड टू बी कीप आवरसेल्फ टू बी क्लीन. इसके लिए क्या किया, दे हैव बीन स्टार्टेड ए स्वच्छ भारत मिशन and been given a so much priorities and given first consider of the education institution to create an awareness to the publics. So based on that, they have given several tasks, and every year on the October 2nd, the every institutions have been doing major functions to create awareness among the publics about the cleanliness on behalf of Mahatma Gandhi birthday celebrations. The next slide. As there are meanings said by the cleanliness and about the Swachh Bharat, first let us see about the what the Mahatma Gandhi ji has been said. I will not let anyone walk through my mind with their dirty feet. It is been quote said by the Mahatma Gandhi ji. And then for the Swachh Bharat scheme, the government of India has been invited their celebrities. One is Anil Ambani, the industrialist, and the Amir Khan. They said their feelings about the Swachh Bharat Abhiyan. Next slide. And this is the initiation in the year of 2014. It is been launched. Steps taken by the government of India. Next. And this slide, why have been kept means, being a human, we should have the differences among the animals and as for the human beings, right now. So that's why I have been selected this slide. What India is been treating, that is major problem why Indians are been suffering from the communicable disease and the malnutrition because of the open air defecation. This is a major problem in India. Still now we are suffering from this. There are several schemes, foundation, Rockefeller Foundation, they have been given a fund to constructing of a toilets. Even though the peoples who are been living in the rural area, they are been neglecting the importance of the toilet in the toilet rooms. So still they are been following the open air defecation, it making the peoples to be suffering from the communicable diseases and as well as the malnutrition. This is the major cause in India why you are been developing those kind of the diseases. It enters to the orophycal route. Medical terminology, that is, it's called as a orophycal route. To make you understand, I can say the kids or the children are going to play in the open places. They will play with the bare hands and they will come to house and they will eat immediately without washing their hands properly. So what it happens, the bacteria or viruses which is being presented in their fingers and in the nails, it enters directly into their mouth and it will goes into the gastric system, gastrointestinal system. There it got multiplies of the bacteria and it causes the diarrhea, cholera and such other diseases. So that is why hand washing before touching of any kind of an eating substances or in any object, hand washing is very, very important. So this is the slide, it's telling about we should have the differences between the animals and as for the human. We should not be the similar. So that's why I will advise, and it is my kind of a request for all the students who are participated in this induction program today. Please try to utilize the toilet rooms to avoiding of the communicable diseases and as well as the malnutritions. Next slide, please. And this is the same way going passing of urines in the open places, that we have to be stopped first to get implement how we are going to be comparing for the western countries, and we ourselves has been neglecting where Indians always be like this. Okay, so that's kind of mentality or kind of an attitude we should not become from our beginning of life. So just you have been completed your metric educations and you are joining for the your polytechnic courses. Just that is my kindly advice that you people follow the strict hygienic practices for your life, and you can able to advise to your family and your relatives so that we can create awareness among the publics and we will avoid the maximum of communicable diseases. This is one of the slides. Because of this only we are going to get the poor sanitation problems and then we are getting the health issues. We are seeing so many airborne diseases. Recently we have been affected, that is the COVID-19, and before that we have the SARS, and before that H1N1. There are many diseases which can spread rapidly by the airborne. That is the one of the biggest problems. So that's why we should avoid these things to be keep our country to be clean. Next slide. And these are the activities what the education institutions can do. This is our MIT students, nursing students has been did the NSS camp and they have been cleaned one of the villages. So and created several awarenesses on the publics in that village, and they have conducted their several role plays and dramas to keep their village to be clean. So our students only has been cleaned that village and they have been given a drama and role play the importance of the cleanliness in their villages. So then the publics of that village has been committed that they will be keep their surroundings to be clean and they will be assured us they will be keep their village to be very clean. So that is one of the advantage the people has been get from the students. So that is why the education institutions is having a very vital role to create an awareness among the public about the cleanliness and about the hygienes. Next. Society clean. How it is been? It is a role of every citizen in the country, that is to be keeping of their surrounding to be clean. That's again the impression of to the other peoples and the elder peoples, because you are in the age that the young peoples of the country, you have the much importance in the role to creating of a awareness. So that's why how to collect a waste products and how to it is being thrown out of the your house or of the nearby places. That is why collecting, storing, and again it is going to be discarding. These are the steps to be followed. Collecting of the wet and the dry waste products, keeping in a separate containers or in a buckets or what are the sources available in your village or in your homes, and then you have to be neatly to be discarded in the selected places out of the your village or out of the your city, so that we are going to be keep clean of our society. Next next slide. Health. As per the Gandhijis, the health is that the real wealth and not the pieces of gold or a silver, because if you are be not going to keep our society to be clean, definitely in future we are going to pay for the hospitals for our health checkups. One example I will tell you, already in foreign countries it has been started. I have heard that peoples are paying for the oxygen. How we are paying for nowadays for the water cans, 20-liter cans we are buying now for 30 rupees and 40 rupees. In the same way, for 1 liter of oxygen, they are going to pay aroundly as per our India 500 to 1000 rupees cost per day they are going to pay. How much it is been cost? The entire life we need to be without oxygen, we are can't be survive. So that is why my kindly advice for you peoples, the young peoples, we have to be clean our society and tree plantation so that we are going to get the adequate oxygen. Otherwise, what will happen? Definitely the environment is going to get polluted. That polluted air, if we are been inhaling, we are going to be suffering from the respiratory infectious diseases. For example, pneumonia, asthma, etc., etc. Already, most of the our countries in the metropolitan cities, for example, Delhi, Mumbai, Pune, Bangalore, and other industrial cities, even including Aurangabad also, they are the high risk places for a airborne diseases because of the pollutions. Where the industries are being located, automatically it's going to be releases a toxic materials into the atmospheric air. That air, the peoples who have been residing in that city or in the surrounding places are going to be inhaling. Because of that, we are going to be losing of our health. That's why Gandhiji has been said that health it's me real wealth. That is only our property. If we are been not going to be maintaining, definitely we are going to be pay for it. If you have been how much property if you have been gaining, even it is a gold matter or in a proper or in a silver, what kind of it is, it doesn't matter. First we need to be concentrated on our health. Next slide. According to the WHO, what is meant by health? So WHO, the World Health Organization, has been given a definition. Health, it is a state of complete physical, mental, and social well-being, and not merely absence of a disease or infirmity. इसका मतलब a complete state of physically, हमने कैसे आदमी को ये हेल्दी है बोल के डिफाइन कर सकते हैं, नहीं तो हम बोल सकते हैं by seeing of their physical strength, मतलब फिटनेस, कैन ही एबल टू वॉक और कैन ही एबल टू डू हिज वर्क हिमसेल्फ, किसी के ऊपर उन्होंने डिपेंडेंट नहीं है, उसको हमने फिजिकल हेल्थ बोलता है. मेंटल हेल्थ मतलब टेकिंग डिसीजंस, उसको टाइमिंग का सेंस है, ओके, एंड डेज एंड आइडेंटिफाइंग ऑफ द अदर्स relatives or family member, that is a mental health. And social well-beingness, it means how he is having the communicating with the other peoples in the society. So it all considering these factors, it is considered them as a healthy individual. That is the definition. And next I will going to move to how to maintain a health. हम health को कैसे maintain कर सकते हैं? So that is here your habits only, how we are going to be maintaining of a good health. So that is first we need a good nutrition to stay fit ourselves, and then daily exercises and adequate rest as per your age, minimum 6 to 8 hours sleep in a day. If you are going beyond or lesser than that, you may having the health issues. Okay, so that's why we should have the good nutrition first. Matlab 3 meals in a day according to our Indian food pattern: morning breakfast, afternoon lunch, and the night dinner. In between, if you are having the social economical status, then you can go for the snacks and all. But minimum 3 meals in a day, that is a good nutritious to keep ourselves to be free from the anemia. And then regular exercises. How it has been, wake up in the early morning and to do the exercises, at least for walk, or you may do the exercises as per your physical limitations. You should not go. If you are been going behind of your physical limitations, again you will be having the problems for your bones and joints. And about the good habits, because in your age there is a forces by your peer pressures. मतलब आपको फ्रेंड्स के हिसाब से आप पढ़ाई करने के लिए आएगा कॉलेज को, and the friends are going to be make you force have cigarette or alcohol, whatever it is. If you are being addicting for those abuses, that is called them as habits, it definitely going to spoil your health. So that's why to keep healthy ourselves, that is our main responsibility. We have to have a food properly, and we have to do the exercises properly, and then we should avoid the all the bad habits, and we should have the good habits like reading a newspapers or getting information about the health, okay, what is happening in your surrounding and in your country or in your state. So that is the good habits we need to be developed, and thinking in a positive way for others. So then only we will be healthy. Next slide. The factors affecting the health, it's about social and economical status. It means the reputation of their families of an individual in the society and their economical factors. So मैंने पहले बोला था आपको 3 meals in a day. It shows their economical status. If they are being affordable to take 3 meals, so then they are going to be, because the peoples are been doing the coolies, and then suppose they belongs to the below poverty level, we have the categorization in the economical status, right? So in that aspect, the good, at least feeding of their families, okay, if the family, if it is a nuclear family or a joint family, if they are adequately able to get their food properly, so then having the conditions, they're having the good economical status. If it is been lesser than that, so they have to be strive for the food. So that's why they may not able to get it. That's why we are calling them as a low socio-economical status of the people. And then environmental factors, it is about our society. Recently we are all affected. Environmental factors, the whole world have been fighted against the COVID-19, isn't it? That is a well example I can give you. It is a live example for you people. All of us are being damaged with that. That is the environmental factors. And most in the coming days also, soon after the monsoon, the peoples, we are going to get a problems because of the sanitation problems. So that is the environmental factors. And then about the personal factors about our habits and the cleanliness, how we are going to be keeping. So that is the personal factors. And then about the hereditary factors, means the diseases are going to be transmitted from the one generation to the another. One example I will give you, the diabetes. It may be there for your forefather or maybe your grandfather. It is not affected for, that is why hereditary factors we are going to be called. So these are the factors are influencing on the health. Next, I am going to move for the promotion of health. Yes, we have been understood the health factors kaisa hai, how it is going to be affects, and then how to promote it. There are 3 factors in this. That is health educations. We have to be create awareness to the publics by providing a health educations within their local languages or regional languages. If you are being coming in the Maharashtra, if you are going to the regional places, if you know their mother tongues or maybe their regional languages, better, that is a good way to communicate with them and giving educations how to maintain a health and cleanliness and uska importance. And then about the health protections, how to get protections. The Indian governments are having the vaccination system, that is called them as a immunization, Lasika Kendra. Okay, that is in Hindi or in Marathi. In that, getting vaccinations, That is a preventive way. That is the third factors. Preventing. How we are going to be preventing? Before occurrence of a diseases, we should get the vaccination. That is a health protections. How we can be protected from those communicable diseases. Already we have several vaccination system. Polio hai, okay, tetanus hai, diphtheria, and then about hepatitis and other vaccination system is been included. And now we are going to get within this week, India is in announcing coming week they are being administer the COVID vaccines also. Means we are going to be protecting from those diseases before it occurs and before it damage our health. हमने वैक्सीन लिया तो उससे सेफ है. So that is the calling the health protection and the prevention. वो आने से पहले how we can be prevent it. That is about the promotion of health in a three way: health education, and then health protections and the preventions. The next slide is that a healthy human being has a generally the following features. हमने कैसे healthy individual को consider करता है by looking in their appearances. हमको एक आदमी दिखा तो how they are been appearing. That is by the clear skin without any wrinkles and foldings, bright and clear eyes. Okay, there should not be sunken eyes, and it cannot be pale yellow colors and the pale white colors. Okay, that should not be there. And without any dilating or constricting. So we are not considering them as a healthy individual. There is a problem with their eyesight. And then about the neither too fat or not too thin. Then we are calling as a categorization here, malnutrition pay. If it is too nourished and is a too fat, we are called them as a obesity person. If they have been very lean, we have been degrading them as for the malnutritions. They are been anemic. So this is the two variations. आदमी ज्यादा मोटा है, for them we are called them as a obesity persons. Okay, previous slide, sir, please. Previous slide, yeah. Fresh breath, okay, wheezing sound nahi aane ka, and then good appetite. Time to time you should get the hungry, भूख होना चाहिए. And then good sleep. You should get a 6 to 8 hours sleep, and then regular activity of bladder and bowels. Daily defecate होने पे early morning wake up करके you should go to defecations, what we say, using of toilets. That is one. And then coordinated body movements. You should good walk and all. These are the healthy individual factors. Next slide. Hygiene. This is about, we're talking about cleanliness and health. Now we are going to move the hygiene. That is about importance of health and hygiene. How we are keeping to be cleanliness. Oral hygiene, just after the wake uping, doing brushing, and then bathing regularly, and hair care, we should comb our hairs. And then foot hygiene, toilet, hand hygiene, and then coughing. While coughing, we should use kerchief or whatever the sources is available with you. If it is tissue paper also, it is okay. Just we have to be use. Otherwise, just we have to be cover our hands, and then we have to be wash it later on. And then keeping our home hygiene, arranging the things properly. Okay, that is all hygienic factors. Okay, especially in this season, I would advise you, if you have been getting sneezing or coughing, just use your hands by covering your hands and use a kerchief. That is the best advice, so that we can avoid this transmitting of the droplets into the atmospheric air. Okay, just you can wash your hands after that. Okay, once the sneezing or coughing. So that is the hygiene factors, how we need to be maintained. Next slide. Next slide. Yes. Hygiene definition, it refers to the condition and practices that help to maintain health and prevent the spread of disease. The medical hygiene, therefore, it includes the specific practices for washing of hands. This is as in your house setup. If you're coming to the medical practices, or if you've been in a medical sector, there is separately steps are there that I will show in the next slide, how to wash your hands. That is my advice, that you should practice those hand washing in your daily basis. So next slide. Yes, this is the steps for hand washing. We are teaching for our nursing students and the medical students, just for your people, because you may go into work in industries after your educations. So this is the steps you need to be remember how to wash. First, you have to be pour water either by mug or by the tap water. First, rinse your hands properly and then apply the soap or liquid soap, whatever it is. And then first scrub your hands both and then between the your fingers and then with the backward movement, okay, of the both the hands, and then you go for the thumb rotating and in between the interlock fingers, okay, in between the both the hands. I'm showing the demo here, and then with your fingertips you have to be rub your palm and then with the wrist and then pour the water and then wipe up with the towel or anything. Okay, this is the steps of an hand washing. All of you should do this regular practices while in your college days before going to the lunch or a dinner. This is steps need to be followed, and during your industry works soon after getting your free time, if you have been doing those steps, you will be preventing maximum infectious to enter to your stomach. So that is why we are all advising for our students, for everybody, whenever we go for the awareness, first we will teach the publics about the hand washing, because if you are having a clean hands, we can prevent the 90% of the infectious diseases to our gastric system. Okay, so that's why hand washing is very, very important to keep ourselves to be hygiene. So these are the steps just to remember and try to practice in your regular life. Next slide, sir. Yes. Healthy habits for food. What to eat or what not to be eat. For the breakfast or for the dinner, we need to be healthy diets. Okay, eating of healthy. This is one of the factors to keeping of your health factors. Eating of fresh fruits or vegetables, okay, and then proper boiling of the vegetables, and we need to be have it. Otherwise, again, we are going to suffering from the worm infectious diseases. Okay, because if you have been not washing properly of a vegetable or a fruit which has been presented in that worm, it will enter to our GS system. We are going to suffering from the again diarrhea or certain other gastrointestinal disturbances. So that's why we should wash the vegetables or the fruits properly and we need to be consume it. These are the eat healthy foods to stay you healthy. Next slide. Importance. It improves the personality, food, and it makes the people admire at you. Means by if you have been a good nourishing, so it is they will take it as a role person. See how he is. वो कैसे है देखो, उसका देख के सीखो. So that is means you will be identifying by the others if you have been having the cleanness, and then makes the environment to be clean. Just keep on creating awareness in your family or with the others just to be keep clean. And then easy flow of verbal communications and discussions. मतलब आपने उसको दूसरों को बताने का. So that is about the verbal communications, and it helps to improve the hygiene in you. If you have been keep on advising to the others, it automatically committing by yourself to be keep clean, and then people learn from you about your secrets of success, because आपको देख के दूसरों ने सीख सकते हैं आपसे. When you have been in a successful stage, उसको देख के आप सीखो बोल के you will become a role person. That's why that is the importance, and you are the winner in this competitive work life. So these are all the importance of health and hygiene. If you have been maintaining these things, definitely you will be the role person in your family. Next slide, sir. Hygiene practices. Actually, I have been said that is soon after your wake uping, how it is to be. Keep yourself to be clean. Again, brush upping, hair combing, and then face wash and bath regularly. It is a daily routine works. Next, it is about safety. Another content of today topic about safety, because after the completion of your course, you will be appointing in a factories or industries. So there, how to maintaining a safety, because health hazards or occupational hazards will be there. How to safeguarding you from the hazards while lifting of an objects or a materials, how you can be a safe. So that we will discuss now. Next slide, sir. work safety. First, safety is the first, and then production. How is the production? If you have been industrial worker, protective equipments by wearing of gowns, okay, protective gowns and the gloves and cap and shoes. These are the protective equipments for the industrial workers. If you have been coming for the health workers, you might have seen in the corona time, the peoples, the working in the hospitals, like staff nurses or the doctors are wearing personal protective equipments. It is called them as a PPE. For industries also they will call, for protecting you, safeguarding you, industry will provide a equipments. That is, if you have been fall on you, it may be safeguards. The same way in hospital, people are using the personal protective equipment. If you have been safe first, then you can work easily. And then follow the rules and regulations in the industries. And then be aware about the hazards, mechanical hazards or maybe the physical hazards in your working place. So that you have to be aware of that. And then health. Every industries, they will be having a schemes, that is a health checkup for their employers. Okay, and they will be have the schemes for ESI scheme and other schemes for employee well-wishment. Okay, there is a rules they need to be follow. And about the insurance policies, during your appointment only, industries will tell you about the insurance they may providing as per their industry norms and according to your wages. Okay, so that is about the insurances. These are the work safety will be providing from the industries. Next slide. Action for safety. How need to be work on it is first identifying of the hazards. How to identifying these hazards? As I said, the physical hazard or the mechanical hazard. Mainly, if you have been working in the industry, mechanical hazards are the high risk. Falling off objects or machines on you, or sometimes it may be gets damage of your fingers or maybe cutting of hands or foots because of while working the machineries, maybe the improper using or because of the old machines, it may affects on your limbs, upper limbs or maybe the lower limbs. So that is why first we need to be identifying of the hazards. Next, control or preventing of the hazards. We need to identify and work safety area, that is we are called them as ergonomics. Okay, and then teach employees to do the all the aboves. While appointing, there will be induction to you as like in the courses. In appointing time also there will be induction classes for you, how you can be safeguarding from the those kind of hazards. Next slides we will discuss about the types of hazards in industries: physical hazards, biological hazards, ergonomic stresses, and chemical hazards. Physical hazards about your physical fitness, your ability of capable, okay, fitness. Biological hazards, again from the bacteria or viruses, any kind of microorganisms which is been presented in your working area. That is about the biological hazards. Next one about the ergonomics. Ergonomics in the sense of your equipments are the system which is been providing to you. Either maybe the table, a stool, chair, a computer with a proper furnishing. So that is called them as a ergonomics. If it is not properly, you people continuously working for 6 to 8 hours in a day. So you need to be sit prolongedly for long time. What it happens, it may damages or it may makes the pain in your spinal cord. Because of that, what will happen? You will going to face a back pain. Major, we will see in the software industries. They need to sit 8 to 10 hours in a day. What will happen after 10 to 15 years when they will become 40 or 45 age? They are going to face the huge the back pain. And again, if you have been going for the diagnosis, they will call them as a disc problem and they need to go for a surgery and all. So that is why ergonomics is very important while working in the industries. You should have the adequate physical equipment, either chair or the stool or table, what kind of the materials they are going providing you as per your work nature. So it should be proper. Otherwise, that could be a damage for your health. That is why we call them as a ergonomic problem. And then about the chemical hazards. If it is an industries related to the chemicals manufacturers, drugs, pharmacy companies, so there, if there have been minor errors may cause huge damages to the industry and for the employee also. Last we have been seen in Hyderabad, gas leakages. Okay, so that is a one kind of a chemical hazard. And previously we have been seen in a Bhopal gas tragedy. There are number of examples are there in your country itself because of the chemical exposures. It damages to the persons or an employee health or completely loss of to the personal industry, and the toxic it will releases into the atmospheric air, and that area completely will become toxic. So that is why it again affects on their health. So these are the types of hazards we need to be remember: physical hazards, chemical hazards, and then biological hazards and ergonomical stress. These are the types of hazards. Next slide. So can you see, sir, actually a dark light problem is there because of heavy rain yesterday night. Next one is engineering, the preventions steps, that is engineering methods and administrative, and then about the PPE, personal protective equipments. By engineering method, constructing of a equipped building with fine materials, and then administrative levels, having the strict rules and regulations to do or not to do, do's and don'ts, strict awareness boards to be placed in the industries. Okay, and then about providing of each employee about their protective equipment so that they can prevent their employees from the maximum health damages. Next slide. Major occupational hazards, the measures to be taken, that is engineering measures, that is the safety, providing the things. Medical measures, what does it says? Periodical checkup of an employee at the time of appointment and in frequently every 6 months once they need to be check their health status. How the employee is being given from their health, because it is a one of the persons in their industry. So that is why medical measures is that each company should have the facility that conducting of a health camps minimum 6 months once, and they should assess their health status of their employee. If it is feeling sick, they need to be providing the leave system for them under their norms. And then legislative measures. The legislative measures, it comes from the governments and from the industries. That is about the Indian Factory Act. Okay, 1947 Indian Factory Act. Under that only all factories have been running. They need to be follow the rules and regulation. Matlab working hours, and then avoiding of the night shift for the women in the mining industry. These are all the legislative measures. In IT sector and all, they are giving night shift, but in the mining area, women are not allowed working from 8 p.m. to 8 a.m. That is the legislative measures taken in our country. These are the measures to controlling of the employee from their occupational problems. 3, that is engineering, medical, and the legislatives. Next slide, we are moving to another content, that is about the gender issues or the gender issue. There is a saying that male dominant society. Are you agree with me, all of you? If you have been, is the country or the society or the whole world, is it a male dominancy or the female dominancy? As per my opinions, it is a male dominant society. We are not allowing female to become forward in wherever the sectors. Now it has been improving, but still there is a stigma that is a male dominant societies. We are all greedy about the male childs or other things. That is about the male dominant society. It is the gender issue, how it is been. We will see now. Next slide, sir. Discrimination about the men and women. That is a pervasiveness in long running phenomena, that is the in Indian society. As we says about the gender ratio between the male and female, for every 1,000 male children we have 930. मतलब हर एक 1,000 boys को 930 girls are available in present scenario. It means the 70 peoples are lesser as per the gender issues. So that is the stigma. As a statement, it says that according to the survey, especially Indian peoples are more considering about their male children. The next slide is showing that about the statistics. Next slide, sir. Why India is having the more gender issue compared to the other countries? There's a reason here that the parental preferences for the sons, because if they have a male children, they will take care of their old age. That is their feeling. If they have female children, they will get married and they will go to the husband wife. That's why still Indian peoples are been sticking up for that, for a male child. That is a depending on their perseverance. उसको मन में ऐसा बैठा हुआ है, we cannot change it. We need a male child because they will be the caretakers when they are at the old age. So that's why peoples are being sticking for the male child. So that is why still Indians are having the problem with the gender issues. Next slide. And another system problem why they are being arguing or demanding means because of the problems the female childs are going to be face, because once after their educations, again the problematic for the dowry during their marriage system, and after the marriages again there are many problems may occur. Due to this reason, peoples are being demanding for a male child in the society. So that's the meaning of this. Next slide. Again about their incentives, parental preferences, why they are been preferring for a male child as per the survey in India 2011, because every 10 years survey is going to take place in India. Next, in this year only, the survey is going to start by 2021. Maybe by April, May, they are going to take the task to do the survey. So then we will come to know about the availability of this after 10 years, how much it is implemented. As per the 2011 survey, there was availability of 19 girls for the 1,000 boys. Means around 81 boys are not going to have the girls. Means this is the differences. 1,000 boys and there will be available for 919 girls. Next slide. Gender ratio in the 2019 available was in the 2011. I said in the previous slide 919, and in the 2000 in the 19 930 girls. Means drastically it has been increased. 11 girls have been increased for the 1,000 boys. For 1,000 boys, it is around 930 are there. This is the gender ratio in India as per the present statistics. Next one. This is the ratio. Just I made it in a graphical way. 930 girls are available for the 1,000 boys. Yes, sir. Next slide. Continued. In the 2020, the age gap between 65 to 69 age group in India has more males than the females. Below 24 years population, there will be 11 more males per the 100 females. So this is the scenario what we have been facing. But among all the states, the Kerala is the highest gender ratio. That is for every 1,000 boys, 1,084 girls are available. Means they are having high gender ratio in the females compared to the other states. Kerala is having highest female ratio. Boys are less in the Kerala. Means 84 girls are more comparatively Maharashtra or in Karnataka or any other states. They are high in the female ratios. Next slide. Next slide. Yes, this is the age-wise in the urban and rural gender ratio belong the 5 years of age as per the 2011 survey. Next slide. In the current ratio, as per the statistics, it says 947 females for every 1,000 males. So by 2021, we will see whether it has been increased or decreased. If it is in cross more than 970, it has been good. Only 30 will be the differences for the 1,000 boys. In yearly 945, as per the year it has been given here from 2012 to 2019. Males and females differences it is. Next slide. In Maharashtra, it is 12.6 crore